These are stormy times. The planet has wicked systemic problems everywhere we look, and the healthcare crisis is just one of them. We're in a transition between stories. The old story of separation and the new story of wholeness. But the path is not clear and the passage through is not certain. We need a guiding light through the stormy transition. And relying on individual intellect alone is not going to cut it anymore. We need to tune into a higher intelligence than the rational mind. An intelligence of the heart and of conscious community. All the wisdom traditions know this, and science is beginning to catch up. This is where I see the potential of this mind-body community. I want to share a story of two storms of transition, mine and ours, and then, time permitting, a vision for a brave new healthcare system in Aotearoa. So once upon a time, it was the year 2015, a high-functioning doctor and mother had a complete breakdown, triggered by her own perfect storm of life events, including a hospitalised daughter, a crazy startup business, and pelvic arthropathy of pregnancy. It presented as severe chronic pain and postnatal depression. But in fact, it was an existential crisis, a dark night of the soul. This rational, evidence-based atheist was brought to her knees, and after 3 months of conventional treatment, in desperation, which was unsuccessful, in desperation, she went to see a spiritual healer. Everything changed. She had a spiritual kundalini type awakening and would never see the world or medicine in the same way again. Today, she continues her deep healing journey using meditation, mindfulness, integral heart intelligence, qigong, bodywork, and psychotherapy. She cannot return to medicine except as a change agent, but she's not quite ready. She sees her journey as a microcosm of what's happening on a larger scale in health and healthcare, breaking down, waking up, and finally evolving to something more whole. She hopes the insights she's deriving from the inner work will translate into more outer work when the time is right. Meanwhile, in a time and a land not far from here, there was a golden era in healthcare. An industrial revolution had sparked biomedical technical advances that had transformed health outcomes. At last, the body could be quickly fixed with a pill or a surgical procedure. How wonderful! People were relieved because there was nothing they feared more than pain, loss, and death. But alas, it was not to last. Because it was built on shaky foundations, that health could be reduced to the functioning of component body parts. By the year 2018, those who were not in denial could see the warning signs, both in the well-being of the people and the functioning of the healthcare system. Epidemics of lifestyle-related non-communicable disease, unprecedented mental distress and loneliness, more years lived in disability, huge levels of iatrogenic harm, inequalities, industrial action, workforce shortages, burnout and suicide in healthcare workers, escalating financial costs, services unable to meet demands. Yet, the prevailing wisdom was that the leaders should simply invest more money into doing more of the same. Most could not see the perfect storm brewing. A few thought that climate change and environmental degradation were the biggest public health threats facing them in the future. Others said it was global antimicrobial resistance. A few identified loneliness. But no one seemed to join all the dots. No one had considered what could happen if the health effects of all these converged at the same time, together with the effects of mass technological unemployment, the tsunami of chronic disease, population explosion, healthcare blowouts, cost blowouts, and workforce crises. The few brave souls who sensed this reflected with a sense of urgency. Could the storm be diverted or weathered? Would it destroy them all? Most importantly, what could they do, if anything? This story is live, and we're in the interesting position of being potential co-authors. All stories have a moral or seek to bring meaning to experience, and we need to understand its meaning to be the co-authors. So what if we were to apply a whole-person healthcare approach to this story? What clues would the story give us? let's say that the patient or the person is the population. What are they presenting with? Epidemics of lifestyle-related non-communicable disease like chronic pain, cancer, ischemic heart disease, autoimmune disease. Listen to their semantics. They talk of the battle with cancer or being a survivor of cancer, the fight against obesity, killing bugs with antibiotics, and have been constantly stressed and too busy. They look to doctors to fix them and pills. What does this symbolise? A war. A population literally in fight or flight against themselves, each other and nature, including their ultimate life support system and home, the earth. Living a lifestyle of fear-based resistance to natural biological processes. Why? They're asleep at the wheel and have become disconnected from their true nature. Happens to the best of us. They've forgotten that they are nature. They're interdependent parts of a greater whole. They've fallen under the great illusion of separation, so they're disempowered and fearful and live in constant competition with each other. What then is the solution to the healthcare crisis in diverting the full-scale superstorm? To shine the light of awareness on this disconnection at an individual and population level, to awaken and evolve consciousness, to empower and support people to live meaningful lives. Simple, super easy. But how? So we can borrow from the higher intelligence of some well-known gurus, including some in this room. Number one, I'll put some guiding principles. Number one, Einstein. He said, you can't solve a problem with the same level of consciousness that created it. We can't unthink this. We need to tune into our whole body intelligence, integrated at the heart as deep intuition. Secondly, Gandhi, be the change we want to see. So we must carry this out in a way that embodies wholeness, mindful awareness, non-violent communication, compassion. Thirdly, our esteemed colleague Robin here, he didn't say it on this occasion, but he said it on other occasions. We can't persuade, we can't tell people. We need to show them or give them the experience or create the space for that to happen. And finally, I left my book down there, but fantastic book by Terry Patton, which has just been published, An Ethos for Revolutionaries. Nick's holding it there. He tells us that despite we need to be aware of the seriousness of the situation, but we don't need to be all doomsday about it and apocalyptic. We need to try and remain positive and open to the possibility of miracles, and that the perfect storm can be a perfect opportunity. So in practical terms, what does this actually mean for healthcare in Aotearoa? Well, tuning into my own heart intelligence and drawing on my lived experiences, I am proposing a multi-pronged approach, and it involves several types of conscious activism, as coined by my friend Terry Patton. And so the first is inner activism, and that's basically doing your inner work, your meditation, your psychotherapy. And this is a prerequisite. That's kind of a no-brainer. Everyone's got to do it. And the outer activism, of which there are three types. There's in the system, against the system, and around the system. And in my mind, potentially these might be carried out by communities such as the MindBody community, with each person tuning into their own higher intelligence and intuition, their inner activist, to gauge which type of outer activism is right for them, if any. So I'm going to talk mainly to in the system activism. So the new story of wholeness versus separation is a bit too woo-woo. In fact, it's way too woo-woo for Joe Public. It's just not going to be palatable. So as a transition, we need a more watered down and credible story. So I suggest telling the story of moving to a more wellbeing centric system with a view to then kind of nudging people to awakening to wholeness through this. Now, things are already edging in that direction with the government's proposed wellbeing budget, the mental health inquiry, and it aligns well with Te Ao Māori, really well. By wellbeing centric system, I mean one that's truly holistic, so it's integrating mind, body medicine, and the public health approach. So mind, body, spirit, whānau, natural environment. In essence, what this is translating into practice mind-body and population health interventions that are already evidence-based, but they haven't made it into the mainstream yet for whatever reason. And I did present a paper on this at the Mindful Leaders Conference, so I can go into more detail if people are curious. Briefly, it's basically primary, secondary, tertiary prevention, marrying mind-body approaches like mindfulness and the whole body healthcare with interventions to address the social determinants of health. Around the system, just briefly, basically, Robin's Healing Institute of Science, Institute of Healing Science, is a great example of that. Against the system, I'm sure some people have ideas for that. So in conclusion, these are interesting times. The storm of transition is the space between the old and the new stories. It's a shake-up. It's kind of scary, but it's kind of exciting. And perhaps there can be perfection in this storm. To weather this personally and as a healthcare system, we need a guiding light, and that's tuning into our own heart intelligence and that of collective consciousness. Let's see whether this mind-body community feels ready to step up.